Hi everyone, Ollie here and welcome back to another one of these weekly diary videos. I hope you're all doing very well. I've had a very busy week, so there's a lot to go through, but I'm going to try and keep it brief because I want to go to bed. Monday morning we had a lecture on the pharmacology of basal ganglia disorders, and I'm still not in a position, a week later, of actually understanding how the basal ganglia mechanisms work, or at least I don't feel like I understand them very well. So I didn't absorb much of that lecture, and it was very heavy going. And that's very true of this block in general. So we're in block 3, brain and behaviour, so kind of neurology. And CBL, I remember on Monday, we spent I think an hour and a bit just going through our own presentations. So we were teaching each other, as we normally would, various bits of anatomy and physiology. I was doing reflexes, which you might remember, and it was just, we were struggling to kind of we really want to get all the basics down to understand the more advanced topics more easily. There's no point trying to build on a weak foundation, but because the lectures come in so quick and with so much new information, it feels very difficult to consolidate that. And to anyone that's kind of keeping on top of things in this block, good job, because I am not managing, and that's fine. I'm not worried by that because there's still, I think, 18-17 weeks until the actual exam. We've got plenty of time to work on these things yet. Not to mention Easter and block 5 being very quiet, relatively speaking. Tuesday was the day of depression, because it was all about the pharmacology, social psychology, things like that, everything to do with depression as a mental illness and how it's treated, which was really, really interesting, particularly from my perspective. So I guess I'm lucky enough to never have suffered from anything I would call depression. You know, I get down sometimes like everyone does, but I wouldn't want to do a disservice because I know people who've had proper clinical depression and it looks hideous. And in my family, actually, I'm sure there is a genetic link. We seem to have a strong predisposition towards that kind of mental illness, and in fact my cousin actually took her own life because of it. So it's something that I think I want to understand, you know, as much as I can. I guess what I mean to say is that I have an appreciation for the worst set of outcomes that it can produce, and it needs to be taken extremely seriously. I think that's something in this country that we're still not that it's anyone's fault, but it's just something that is now starting to be taken more seriously, and there's still lots of work to do. That's all I'm saying. Tuesday afternoon we were back in hospital once again, and we accompanied a doctor. I'm not sure exactly what kind of doctor he was, but onto I think it was a general surgical ward. So we, again in small groups, were talking to a patient, doing a history. Tom, actually, who was with me, did the beginnings of an abdominal exam like we'd practiced in clinical skills, and we actually finished really early. The department was quite busy, the doctor was clearly very busy, but he still had a lot of time for us, made sure we were comfortable, answered any questions, took us through a CT scan and things like that. I answered a question wrongly that I knew the answer to when he asked me. I just, you know, when you get question stress when you're put on the spot, and I said something stupid, and you know, he just gave me a sort of sad look. And I knew the answer. I knew 100% what the answer was, and I even said it to the person next to me immediately afterwards. But it's a different environment. He was very nice about it. And then, so we finished quite early with him, and we had like another hour and a half to do something with. So actually we were in a group of 4, we split down into 2 groups of 2 and just went back out on the wards. We still had time to fill, we've got access to everywhere now, and went to find another patient to talk to. And a lot of the wards were pretty busy, but actually a cardiology consultant took pity on us and found us a patient to talk to and take a history from, and he said, right, you know, you boys go in there, take a history, then come to my office in 15 minutes and present it to me. And it was a really nice patient. We took a history, we learned what we could. He wished us well, very pleasant. Then went to the office, did a terrible job of presenting the history, because it's not really something it's not something we've been taught how to actually formally present a history. So the consultant made us write down like the 5 steps to delivering a perfect history, which was so useful. And he didn't have to do it, but he took the time for us very lowly first year medical students. And it's a great lesson. You know, you learn through failure, I suppose. But crucially, at least where we are, George Eliot Hospital, with the junior docs are all lovely as well, and the consultants and the regs, it's a very safe environment in which to learn. You might be a bit embarrassed or something, but you know, you remember it long term. Wednesday we had our last session of that CBL case in the morning, and we focused mainly on the social aspects of neurological trauma. So if someone, you know, were to have a stroke or some sort of cerebrovascular incident or a paralysis or something, what are all the different factors you have to consider for reintegrating them back into their old life? And sometimes that's not going to be possible. But we talked about the role of allied health professionals, people like occupational therapists, which I do know a little bit about. My mum is one. And, you know, social care, physio, all these other things that you have to take into consideration. You can't just like send them in for surgery or pump them full of drugs and then get them out of the hospital. It won't solve the problem. What your focus should be on in that situation is in long-term care and reintegration and resuming activities of daily living. Then in the afternoon, we went to an optional lab session where we did electromyography. So that's measuring electrical activity within the muscles. So I don't know why I'm bringing my arm up. You know what a bicep and a tricep is, but we attached electrodes on, and then you sort of tense or elicit reflexes, and we watched on a computer screen the lines move basically in response. And I actually uploaded another video onto the channel called like electromyography in the lab or something. We had to do legs as well, so you did quadriceps and hamstring testing when you do reflexes, like your patellar reflex in your knee when you hit it with a tendon hammer. You can watch the lines jump about. But we were all wearing skinny jeans, so the solution we reached, the block lead said, right, one of you like is going to need to take your trousers off, and she brought us some lab coats. I say us, I was the only one that ended up doing this, but I like fashioned a tunic around my waist made out of this folded up lab coat, took my jeans off, and attached the electrodes properly, and we did the tests and they worked. But it was very embarrassing. It's very funny. It looked like I was wearing a giant nappy. I recommend looking at the video or looking at the blog post, because there's some really funny pictures in there. Thursday morning we started a brand new CBL case all about stroke and transient ischemic attacks. I still can't say the word ischemic properly, but and again focusing on similar things, long-term consequences and the long-term treatments you would need to put into place. We actually had that afternoon, I remember, 2 lectures taught by a consultant neurosurgeon, which I'm really glad I went to. Not everyone did, but neurosurgery and neurology in general, they're areas I find so interesting just because of the brain as this biological structure. I said in last week's video it's about the size of 2 fists, I think, or at least someone told me that, but it contains so much of kind of the essence of what is a person, and it's just stunning. And on that note, actually, one of these lectures was all about the processes and the nature of consciousness. It was sort of what structures in the brain and what processes give rise to consciousness according to current models of understanding. And then this was followed by another lecture on head trauma. And he didn't stick to the slides very well. That's one of the thing you'll notice when you come to Warwick about external speakers, is the learning objectives and then what they actually tell us don't always map up extremely well. But it was really interesting because he was going off on these little clinical tangents. It was just like listening to somebody talk about what they did, and he was clearly very passionate about it. And they mentioned at the end of the lecture actually the opportunity to sign up for some neuroscience lab work. There's a team of neurosurgeons wanting students to come and help, so end of the lecture, went and signed up for that because that sounds very cool. I also started selling raffle tickets for the Clinical Neurosciences Careers event that will be next Thursday, 1st of February, so a week this coming Thursday, which I recommend you all should come to. There's another video on the channel. Google WMS Neurosciences Clinical Careers Evening, something like that, you'll find it. Friday morning, back in hospital, and we were doing cranial nerve examinations, and this actually I found easier than some of the other things we've done, because it's a lot less abstract. As long as you know what each of the 12 cranial nerves does, you should be able to think of a few ways in which you could test them. So it's a really logical set of 12 sets of examinations you can do to test all of them. And again, I don't know whether I've brought this up before, but dirty mnemonics, and anyone with any sort of medical background will probably know the one for the 12 cranial nerves. And the dirtier a mnemonic is, I think the more likely you are to remember it. And the doctors that tell us about them, the doctors just tell us, right? They say, this is a bit rude, but whatever, here it is. It's funny watching the academics try and tiptoe around it without having to directly tell us. But for the cranial nerves, it's O to touch and feel a virgin girl's vagina and hymen, which is obviously not a very pleasant thing to say, but it really works. You can remember the 12 cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, going back to 11, accessory, and hypoglossal. And actually, I went to radiology early, so we had a radiology class earlier than we usually would in the block. But I thought it was starting at 1:15. It actually started at past, so I got there early. It was just me there, but I got into a really interesting discussion with a couple of the radiologists there about the state of the NHS and how they think medical students now are given a much lower level of responsibility than they would have had when they were training, and they were just wondering about the effect that would have even on the quality of junior docs that are coming through. In the evening, there was an event, I think it was called So You Want to Be a Surgeon. It was being run by the Surgical Society at Warwick, who are probably the most well-renowned society, I think the most respected, because of the amount of anatomy teaching they do. And there were 4 speakers, 3 female and 1 male, I think that's right, if I'm counted properly. And it was just generally talking about their different careers. So there was a general surgeon, there was a urologist, orthopedic, hand surgeon, and a maxillofacial surgeon. And it was nicely just realistic. 3 of the speakers were female, as I say, and they were talking about family life, having children and becoming a surgeon, and trying to balance everything. And I say this a lot, I certainly feel like I've written it a lot. Whenever you talk to surgeons about their career and how they trained, they're just like, the money's crap, the hours are crap, it consumes your entire life, and it's really hard to make your social relationships work, but it is doable, and they really wouldn't rather be doing anything else in the world. And that's really, really cool, to see at this stage. And actually, myself and a friend that were there, called Ollie as well, actually, so that makes it easy. We were talking to one of the surgeons afterwards, and she actually said if we were interested, did we want to come and get some theatre time with her. She works in a hospital close by, so that was really cool. I think we took her up on the opportunity, obviously, so watch this space. And the last part to say is that obviously yesterday, on Saturday, I went to London to go to the International Undergraduate and Foundation Level Surgery Conference down at UCL, and it was a fantastic day. I recommend the best way to learn exactly what I did is read the blog post on my website and watch the video. I did make a dedicated vlog video from that day. You signed up for workshops in advance. I did not get the 3 that I signed up for. I got 2 of them. So I signed up for basic suturing, how to become a surgeon, which is just like a careers talk. So I learned to suture, not well, but I did start. And I can't remember what the 3rd thing was that I signed up for, but I got advanced suturing, on my little delegate ticket. I thought, given that I've just learned like the very, very basic elements of suturing, and I'm not very good at it, I'm probably not going to go to this advanced one and embarrass myself and kind of slow everyone else down. So I went to Proximy instead, which is a company that they make like augmented reality software, and it's intended to guide surgeons through operations. So they can have sort of someone's hand overlaid on their field of vision, like pointing at what they need to cut. It was really cool, and they gave us a live demonstration. And I'm big into teaching and information communication, and if technology can help with that, I mean, the scope of this thing for medical education is, you know, astronomical. There were some really, really cool speakers there, very, very inspiring. The keynote speech was given by Dr. David Langer, who is a neurosurgeon, I think at Lenox Hill, the hospital's called in the US. But he was giving a talk on patient satisfaction and cerebral vascular surgery, and the kind of improvements in technology, all these different cameras and robots. There were actually two people there from my year at Warwick that I was with for most of the morning, and one of the surgeons in his talk had a video of robotic surgery being done. And there was sort of two, you know, there was one robotic limb, if you like, kind of retracting tissue, and then the other one would come and cut it, and then they would sort of move along, do this very clean cut. But then this third arm appeared, and it really shocked me, and I was saying to my friend that I'd like humanized this robot surgeon to such a level in my head that when this third arm appeared to do something else, it was like, well, of course it can do that. It's a robot. You can control as many limbs as you want. But I kind of was imagining this metal surgeon doing all these things. I clearly need to expand my horizons a little bit. I did a lot of networking as well. That's something I would always encourage people to do. Don't be scared of being embarrassed, because, you know, you go up to talk to someone randomly. If they don't talk to you, so what? You'll probably never see them again. It doesn't matter. But if they do talk to you, then you get a friend. I made a few friends yesterday. So Natalia, Claudia and Cameron, shout out, did some networking, took a lot of video photos for them in exchange for having them in my vlog video. And I managed to promote PostGradMedic quite a bit, because there were a few sixth formers there, or you know, uni students wanting to do graduate entry medicine who are maybe doing biomed or whatever now. So that was a really good opportunity as well. As ever, I cut my estimations for getting to the train station really, really tight. So I ended up having to run from a coffee shop near UCL to the train station, so it was like a 28-minute walk that I had to do in 20 minutes. So I was pelting across London trying to get back to Marylebone Station, and then I had a really interesting conversation with the person sat next to me on the train, who was an accountant, about the NHS and about training as a professional. You should speak to people on public transport as well. The conversations you can have with people on buses and trains. My favourite example I've maybe mentioned before, but I had a guy explain corruption in the Nepalese construction industry to me on a train. He was a journalist. Or equally, when I was coming back down from Edinburgh, I was talking to a cardiac nurse about she was telling me about the best ways to interpret ECGs. You can learn so much. Just prompt conversation. I really, really encourage you to do that. And the very last thing I want to mention before I go, because this is dragging on way too long, is I had my first email back this week from somebody who I mock interviewed back in early January or over the Christmas holidays, and have received an offer to study medicine at the University of Brighton. So congratulations, Simon. I wish you the very, very best with your degree. I'm sure you'll make a fantastic doctor, probably far better than I will. And the thing is, I've got no way of knowing whether what I did in those mock interviews actually helped anyone, because if anyone gets in, it could obviously just be that they were an amazing candidate, which I'm sure is true anyway if they've gotten in. But it is nice to think that the materials helped. You know, producing the stuff does take time, and to think that that energy has made people feel more happy and confident about applying and obviously getting in it just makes me feel so happy. So if you do get in, if you don't get in, do let me know if I've spoken to you, how things are going. I love that interaction with you guys. It's why I do this. You know, to be helpful. Hopefully you find it useful, but that is where I'll wrap up. So thank you very much for watching, guys. Please be sure to hit that like button for me, leave a comment, subscribe to the channel, and don't forget to go and check out PostGradMedic.com for more free content just like this. There's some useful articles in there and new things going up all the time, as well as a daily blog of medical school life as a graduate student. Take care, guys, and I'll see you next week. Bye.